If you've ever left a doctor's office feeling dismissed, confused, rushed, or just alone in what you were going through, let me tell you about a recent experience I had. It was definitely not something I'd sign up for if I had a choice, but here's the thing. It was also one of the most profound and, dare I say, loving experiences that I've ever had in a medical setting because of how the team took care of me. Their care changed the entire experience, mentally, emotionally, physically, nervous systemly, and it reminded me of something I think everyone with fibromyalgia needs to hear. Good care is not extra or optional, and you are not being extra or too much by wanting it. Good care literally changes how your body experiences what's happening to you. Hi, I'm your coach, Tami Stackelhouse, and this is episode 187. If you listen to episode 185, the episode on uncertainty, you heard me talk about having a breast biopsy and then having to wait for the results and how that completely derailed my brain for a while. But today, I want to tell you about what actually surprised me in a good way about that experience. And don't worry, if you haven't listened to 185 yet, this episode will still make sense. You can go back and listen to it when you have a minute. So yes, the procedure itself was stressful. But what actually blew my mind and made the whole thing memorable was the care I received. Now, before you start thinking it, this is not a story of how I finally found good doctors. I know I am blessed. Yes, I have amazing doctors already. In fact, on a scale of 1 to 10, most of them are 11s and 12s. I have amazing providers, and a lot of them are actually even my friends. I have my primary care doctor's personal cell phone. Having said all of that, I wanted to kind of set the stage there. Having said all of that, this experience still blew my mind. It was a whole level of care that I didn't even know was possible. So, today we're going to talk about what that care looked like, exactly what happened, how I helped myself in the situation, and what it all means for you. So yes, I'm looking at the calendar here, about 2 months ago, I had a breast biopsy. They found a couple of tiny little spots on a mammogram, and I had to go in and have the biopsy done. It was a mammogram-assisted biopsy, so I was literally in the mammogram machine while they stuck a needle in. It was stressful, okay? So before we even got there, they explained everything. Before I set my appointment, they had the doctor come in and explain everything that was going to happen. And then when I arrived the day of the biopsy, the nurse went through. Actually, I don't know if she was the nurse, the tech. She's the one who normally does my mammograms. She went through the entire thing, explained in a lot of detail exactly what was going to happen, which really helped a lot, right? Because knowing what was going to happen kind of calmed my fears a little bit. Then the doctor came in and he explained again what was going to happen. Not quite in as much detail, but he also explained everything that was going to happen. So I knew completely everything that was going to happen to me. Here's where it gets interesting. So they I'm in a chair, actually. They push me up to the mammogram machine. I'm in the machine. And they explained to me that during the procedure, they want me to look off to the right. They were doing the biopsy on the left side. They wanted me to look off to the right. Don't look at what's happening. We want you to look over here from the very first moment so you don't see anything that's happening over here. And they explained that, some people, they feel better if they are seeing what's going on, but most people, they actually do better if they don't see it. And I immediately said, I am one of those people. I don't want to know. Like, do what you got to do, but I don't want to know about it. Maybe you can relate, or maybe you're somebody who wants to watch. Either way, it's fine. But it was, I appreciated that they understood that the stress level goes up if you see a big old needle coming at you, right? So I am looking off to the right, and they're doing what they're doing over here. And the nurse, the tech, she was explaining everything before it happened. She said, okay, now you're going to feel a little bit of wetness as he uses the sanitizer to clean your skin. You're going to hear a little bit of noise. This is what's happening. She literally explained every single sound, sensation before it ever happened. That was also amazing. But she told me at one point, I'm going to hold your hand now. And she grabbed my right hand with her hand, and she put her hand on my back. And let me tell you, I just about lost it. I just about started crying right there. The thing is, if she had asked me, now you might be thinking, that's okay, that's weird, total stranger holding your hand. If she had asked me, I would have said, nah, I'm fine. You don't need to hold my hand. I'm a big girl, right? And it does sound a little weird talking about how a stranger holding my hand made me just about cry. So she didn't ask, she just did it. And apparently, let me tell you, apparently my emotional self, my nervous system, my brain needed something that I didn't even know I needed, right? Because if she had asked me, I would have said, no, I'm fine. But clearly, I needed that. She held my hand through the whole thing. She was still explaining everything that happened, every sound, every sensation, still holding my hand. She even squeezed my hand at a few points, so I didn't feel so bad squeezing her hand back when I was a little bit scared. It was amazing. I know this sounds silly, but it was amazing. And then at one point, after they had taken the biopsy, her and the doctor needed to leave the room to check the biopsy, make sure they got everything that they needed to get. Before anyone left the room, someone went out. So one person stayed in the room, one person left the room, brought someone else in to stay with me, to talk to me, to keep me looking off to the right because I'm still in the machine, and keep me company while they went and checked the biopsy. They never left me alone, not for a second, and that was good. Kept my mind off of what was happening. The other thing that was really interesting is that they explained everything at the beginning. They asked if I had any questions. I never felt rushed. I felt like they were taking their time, but I also wasn't sitting around and waiting. So everything kept moving, not rushing me, but also not making me sit there and wait. Because, you sit there and wait and it just gets worse, right? The thing that I can best say with all of it is that it was obvious that they were caring for a person who was having a biopsy, not simply just doing a biopsy. There was a huge humanness to it all. And it was so funny because when I left the center and was walking out to my car, they had a big sign that said human kindness. And that's like their motto. I was like, yeah, that is exactly what I received. Human kindness. Now, here's the interesting part. After they had done the procedure and she was, putting on the bandage and taping everything up, the tech, the nurse, whoever she was, she said that she had actually had the same exact procedure done herself just a few weeks earlier. Now, I don't know if that changed how she cared for her patients, if she always held their hand, or if that somehow changed after her experience, but you know it factored in, right? When you have that lived understanding of being through something yourself, you have such a deeper level of knowledge and of appreciation for what someone is going through, right? It's the reason why someone who's going through the same thing can give you a level of empathy that someone who just cares for you but hasn't experienced it the way that you have, right? They can't give you the same kind of empathy. So that lived understanding, right? Knowing from the inside how this is happening. Her body and her nervous system understanding what my body and my nervous system are going through. And it really struck me, not to state the obvious, but it struck me that that's exactly what we do as certified fibromyalgia coaches, right? We all have fibromyalgia. We understand you in a way that your doctor most likely is never going to be able to, unless they have fibromyalgia themselves. Sometimes they do, but most of the time they don't, right? So that experience, like even now, thinking back to how they made me feel, gets a little emotional because it was exactly what I needed. I had to go through something unpleasant, and they made it as easy as possible. When we were done, she asked me, so how do you feel? How was it? I said, that actually wasn't that bad. Not that I'm signing up to, come back for a repeat, but that wasn't that bad. And the thing that made it not that bad was her care, her holding my hand, her explaining every little thing before they did it. Now, the doctor was good too. I mean, some people are better with needles than others, right? So he did his part. But you have had good doctors who are good with needles before, and it wasn't this kind of care. So there's not always a lot you can do to make sure you receive that level of care. You can advocate for it, sure, but sometimes that is just a gift from heaven. It certainly was for me that day. But there is care that you can give yourself, right? So before I ever went into the clinic, there was care that I gave myself. And I like to call it unapologetic self-care. People use terms like radical self-care or things like that. For me, it's really about being unapologetic. You do not need to apologize for what you need. What you need is what you need, right? And this isn't about pampering. It's not about overreacting. It's about responding to something real that's happening in your body and in your life and providing real support for it, right? So for me, a lot of that was preparation, thinking ahead of time about, okay, this is going to be kind of a scary deal. So how can I clear my calendar to make sure that I'm not already going in stressed, right? I mean, it's going to be stressful. I am going to be walking in stressed out, but I don't need to also be walking in stressed out because traffic was crazy and I'm rushing from my last class or anything like that, right? I made sure I left early. I made sure I canceled things around the appointment so that there was no rush. I also made sure that I was well rested and well fed, right? When we are tired, when our blood sugar is low, our capacity to handle stress goes way down. So I made sure I was rested. I made sure I was well fed. I'll be honest, I took some extra medication and I took some extra supplements. Leading up to it, I did take some extra supplements specifically designed to help support the neurotransmitters that help us deal with stress. Things like GABA, things like 5-HTP, made sure I was right on top of those, taking them. And I will also fully admit that before I went to the procedure, I kind of backed up when I needed to take these, but I did take some pain medication. I didn't know how much it might hurt or what they might give me there, but I took some tramadol. And yes, I also took a Xanax. I personally, now whatever you may think about medications, I personally believe they are tools, right? Tools to help us do whatever we got to do, right? It's no different to me than an ice pack or a heating pad or a handicap parking pass or a stool in the shower. These are tools. You do not get bonus points for white knuckling your way through life without using any tools. Okay, so I used the tools at my disposal, took some tramadol, took a Xanax. I also planned my recovery time. So I scheduled the appointment on a day where I knew I had no classes, no clients the next day, and even made it so that the rest of that week was pretty light and had the week off afterwards. Maybe a little more time off than I needed, but come to find out, as you might have heard in episode 185, this added stress caused all kinds of things that weren't totally expected, right? So I had quite a bit of nervous system overload. I wasn't hurting. I actually didn't hurt really hardly at all. I had an ice pack in my bra for that day, but that was about it. I didn't even take any Advil or Tylenol afterwards. It really didn't hurt that much. But my nervous system, oh my goodness, severe overload. I realized that what I was dealing with was that uncertainty, which is what that other episode is about. But it made me super tired. My brain just wasn't fully functioning. I was catching myself being late to class. I'm the teacher. I was late to class, and just all kinds of other things. Like I just couldn't focus to get my work done. I was just so tired all day, even when I got my normal amount of sleep. So realizing, as I said, this is a real thing that's happening in your body and it needs real support, I actually canceled some plans. I laid down on the couch and took a nap a couple of different days. I slept in. I went to bed early. I moved deadlines around so that I didn't have to make any major decisions. Now, I realize a lot of these things I could do because I'm my own boss, right? It's my company. I'm the one who decides what the deadlines are in the first place. So I'm just going to decide to move them. And I realize not everybody can do that. But if you are going to be going through something like this is where that advocating for your needs comes in. This is where you maybe need to go to your family and say, hey, I'm going to need more help than I thought I was going to need. Or go to your boss and say, hey, this actually took more out of me than I expected. I need some time, or I need to pass something off to somebody else. These are all things that you actually could advocate for. Again, the main point here is simply treating what's really happening as a real thing. In episode 185, I kind of mentioned that at one of those days I was running late to class. I was like, oh gosh, what excuse can I give them? I didn't really totally think of it like that, but that's kind of the emotion behind what I was thinking. And I thought, whoa, hold up. You don't need an excuse. This is real. There's real things that are happening to you. And so getting the support that I needed, I shared what was happening with me with my students. Said, hey, just so you know, this is what's going on. My brain isn't all here. You might need to remind me about a few things. I might not be as timely as I like to be. I talked to my alumni support group and said, here's what's happening. If you need anything from me, just know I'm not all here, and check back in with me later. Having people know what's going on with you, they don't even need to necessarily know all the gory details, but just, hey, I'm going through something right now. I just need a little extra grace. I need a little extra kindness right now. Totally fine. Here is the bigger lesson in all of this. So there's kind of two lessons. One is the practical lesson of give yourself good care, right? Plan ahead. Use all the tools at your disposal. Advocate for what you need. But the second lesson is that the right care, good care, actually changes what your body experiences. That's not extra. That's not a bonus. That's not fluff, right? That good care I received changed how my body experienced what was happening. It changed my fear level. Both me taking Xanax, I mean, let's just be honest, that helped. But also the woman holding my hand and explaining every sensation, every sound, everything before it happened, right? Allowed my body to relax and not be so tense. It allowed my nervous system to recover more quickly afterwards. I'm sure it also caused less pain, right? I mean, you know how it is with fibromyalgia. Fibromyalgia is an amplifier. And so any pain that we feel, if your fibromyalgia is cranked up, it's going to turn up the volume of any pain. So even though I didn't experience much pain, fibromyalgia would turn up any pain I did have. But because my nervous system was calm, I was calm, she took really, really good care of me, physical contact, all of those things are actually known to change how your body responds to pain. There is, just as a total side note, there is a fabulous interview that I did a couple years ago with the authors of the book, When Children Experience Pain, or When Children Feel Pain. Just check today's show notes. It'll be in there. I don't remember the title exactly. But some of what they talk about in their book is how, like the simple things that you can do that literally change your experience of pain. Physical contact is one of those. Sucking on something sweet is another. So yes, I actually did put something in my mouth before the whole thing started. So sucking on something sweet, physical contact, those are two of the things that can actually change how your body processes pain. Also, definitely changed my emotional experience. Instead of it being a traumatic event, it was weirdly a positive experience. I mean, it's so funny. I'm trying to explain to you something that I absolutely cannot adequately explain. Why something that was kind of traumatic was also amazing. So yes, it had changed the emotional experience. It changed my physical experience. It changed how quickly I recovered. It did not just change how I felt or thought about it. It changed how my body felt. This is what people with fibromyalgia deserve, right? Not just you have fibromyalgia, learn to live with it. Not just you have fibromyalgia, here's a brochure. Not even you have fibromyalgia, here's some prescriptions and go take these supplements. We also deserve that explanation of here's what's going to happen next. Here's what you're going to feel and experience. We also deserve that preparation ahead of time. Okay, if we're talking about taking a medication or going to physical therapy or trying acupuncture or just learning how to better manage your own energy and the way you use it, that explanation of that, the preparation of that, someone who is in partnership with us, someone who is holding your hand and squeezing it at the scary parts. We deserve that humanity, right? That human kindness. We deserve to have care that is aware that we have a nervous system that is easily triggered. With fibromyalgia, that switch between calm and fight or flight, that changes very quickly and very easily, and then we get stuck. We deserve care that understands that. We deserve whole person care. And I don't just mean your whole physical body, right? Because, your brain is connected to your big toe, like it's all connected, everything in between, but also who you are with your emotions, your thoughts, your fears, your history that you come in with, your spirituality, your whole everything that is who you are. We deserve care that recognizes that you are a whole person, not just a body. So, what does all this mean for you? I'm sharing my experience, but there is a reason I'm sharing my experience. There are some questions I would like for you to ask yourself and to think about when you have a minute, whether that's right now and you hit pause or whether you come back to it or just think about it as you go through your day. The first question is, what helps your body feel cared for and safe? You might not know the answer to that. And if you don't, that's okay. The goal here is to start thinking about that, start paying attention. When you're in a space, a time where you do feel cared for and safe, what's happening around you, right? My husband makes me feel brave. If there's any, I wish he could have been with me. It was during the day. He was at work. He couldn't be with me. But if he could have been there holding my hand, that would have been even better, right? Being around my husband makes me feel more brave. So what helps you feel cared for and safe? And some of you, having your husband near you might do the exact opposite. Not everybody has the same resources. So for you, what helps you feel cared for and safe? The second question I would like for you to think about is, where do you need more care and support? That might be something physically, like, you know what? Physically, I need help around the house. I just can't do it all. Or maybe it's emotionally. Maybe you're like, I need someone I can talk to about how I really feel about things. I need someone to take my side every now and then, whatever it might be. Maybe it's something super specific, like, you know what? My headaches are really getting in the way of me living my life. I need someone to help me take better care of my brain, my headaches. It could be anything. Where do you need more care and support? And then the last question I want you to think about is, what would treating yourself with the idea this is real, not what excuse can I give, but, oh, I'm going through something real. What would treating yourself like that actually look like? What would unapologetic self-care look like? Because let's be real, sometimes receiving good care is someone outside of you giving you that human kindness, right? Seeing you as a person, not just a body. If we're talking about our providers, you're a person, you're not just a body. But sometimes that good care is you giving yourself human kindness. So many of us, man, the way we talk to ourselves in our heads, where nobody can hear how bad I'm being to myself. If you had a billboard above your head that printed out what you were thinking, or if you had a loudspeaker that was broadcasting out loud what you were thinking, what you were saying to yourself? Would you be proud of that, or would you be really embarrassed and horrified? I tell you, there are times when I'm horrified. Even still, even after working on this as long as I have been working on this, which is pretty much since my fibromyalgia diagnosis back in 2007, so 20 years of working on this, there are still times where I am horrified at the way I'm talking to myself. I would never speak to another human being like that. I wouldn't speak to an animal like that. I probably wouldn't even speak to my computer. Well, I might speak to my computer like that if it was misbehaving. But the point is, how are you talking to yourself? Are you treating yourself with human kindness, with grace, with understanding? Are you treating yourself the way that you would treat somebody that you love? Or are you treating yourself with contempt, with frustration, with anger? It's hard. So that's your homework from this episode, to think about what good care looks like for you, where you're maybe not asking for the care that you need because you don't want to be extra, you don't want to be that patient. As one of my coaches said, and I love this, she said, what would be over the top self-care for somebody else is our baseline, right? To take care of a fibro body needs a lot of love, a lot of support, a lot of care. And for somebody else, that might look extra, but for us, that's just every day. That's just Tuesday. So think about that. Now, I've got this week's listener shout out for you, and it ties into exactly what we're talking about today. This came from one of our listeners in Arizona, and she emailed me this after she connected with her coach, Jeanette. She said, I have felt so alone trying to navigate my phobia of doctor offices and everyone just passing me along. And maybe you can relate to that, right? So many of us, that's happened to. She said, actually connecting to another fibro patient, that would be her coach, Jeanette, someone who's also a mother, makes me feel less scared. And that is exactly what I mean, right? Connecting with someone who's been there, done that, right? Who actually understands how you feel in that moment, who understands what you're experiencing. So many of us have that doctor phobia. I sort of jokingly, but it's not a joke at all, talk about this sort of doctor PTSD. Many of us have, right? We've had enough bad experiences at the doctor's office that we have PTSD, medical PTSD. Or, maybe it's not just a bad experience like something bad happened, but maybe it's a bad experience like you were dismissed or told it was all in your head or just passed along to the next person. Oh my gosh, I can't tell you guys how many times I hear somebody say, yeah, I was diagnosed with fibromyalgia, but they don't really treat fibromyalgia, so I don't know what to do next. Right? Getting a diagnosis, but nope, sorry, you have fibromyalgia, but I can't help you. Man, we deserve better than that, y'all. We really do. Just human kindness is better than that. So, again, I'm going to read, because I did so much editorializing, I'm going to read that quote again. I have felt so alone trying to navigate my phobia of doctors' offices and everyone just passing me along. Actually connecting to another fibro patient who's also a mother makes me feel less scared. That's what it's about, guys. Feeling less scared, feeling understood, feeling like you don't have to go through all of this alone, having somebody actually tell you how you can get your life back, not just tell you, here's how you can manage your fibromyalgia, but here's how to have your life back. That's what we're all about. Now, as I wrap up, I do want to give you a little bit of an update. So, as I'm talking about taking care of yourself and making sure I practice what I preach. So after my biopsy, they did send off the sample, and it did come back pre-cancerous. So it's not a cancer diagnosis, but it is a higher risk diagnosis. ADH, for those of you who might know. So I was referred to a surgeon. They want to actually go in and do an outpatient surgery. Just make sure nothing funky is hiding down in there. Not everything is going to show up on a mammogram, and not everything can be sampled from just a needle biopsy. So I'm actually going to have a lumpectomy, even though there's no lump. I think that's the funniest thing. And, I'm okay. It's another thing that I am not really looking forward to, but I would rather go in and have things checked out and deal with it than have that uncertainty hanging over my head. And I'm sharing this with you partly so if you're going through something like this, you don't feel alone, but also because I wanted to give you a little bit of an update on what might happen here on the podcast. So I do hope to just keep up with the normal podcast rhythm. However, depending on how my brain and my body feel, I may decide that you need a replay of one of our greatest hits. So depending on timing of everything, on recovery, on my body, on my brain, over the next couple of months, you may be getting brand new episodes, or you might get a lovely curated list of our best episodes. Either way, we are still here. We're still going along. And as the surgeon told me, even if they do find something, it'll be a little blip and I'll keep on running. Those were her words. So I'm not too worried about it. I will see you all back here when I can. And in the meantime, please take good care of yourself. Good care literally changes how your body experiences what's happening to you. And you deserve the best care possible from the people around you and from yourself.